I'm sorry, there isn't any name to call. So, does she have a name or
Adam. Adam.
not?
You are talking with Adam, and the patient is Maria Watson. Yeah.
Hello, hello. My name is Sawsana Hassan, GMC number 8087024. Shall I proceed?
Hello.
Hello, am I talking to Adam? I'm Dr. Hussein, one of the doctors working here in the ward.
Hello.
Hello, Adam. Could you please confirm your mother's name and age, please?
Maria Watson, and she is 80 years old.
Okay. So, I can see that you're upset, Adam. Is there like any reason for that?
I'm totally unhappy with my experience here in the hospital.
Oh, I'm really sorry for that. So, could you tell me more? What's exactly upsetting you?
No one is telling me my mom's condition. She's in the hospital for 2 weeks now, and no one's telling me what's her condition.
Oh,
Is this appropriate?
I'm really sorry that you're feeling that way. I'm here to help you and support you. Do not worry about that at all. I'm just gonna just like ask you a few questions to have a better understanding of your mother's condition, and I will answer as soon as possible. Is that okay with you?
What do you want to know, doctor?
Okay, so could you tell me what do you know about your mother's conditions first of all? T-
You are supposed to me to tell me what's my mom's condition. I don't know anything about her. I just know that she's in the hospital because of shortness of breath. I don't know anything about her.
Okay, I'm gonna update you just in a bit. Do not worry about that. I meant by my question that before being admitted here in the hospital, did she have like any symptoms? Could you tell me more about her?
She started to have shortness of breath, and the neighbor, she called the neighbor, and the neighbor just took the ambulance, and then the ambulance took her to the hospital.
Oh, okay. And do you know that did she had like any other thing like chest pain?
I don't know. I don't know anything about what happened. It's just they told me the neighbor told me that she started to have shortness of breath, and she was just very short of breath. She and they called the ambulance.
Okay, okay, I understand. That must be very distressing on you, what you've experienced. I'm sorry. So, do you know regarding her general health, does she have any medical condition I should be aware of?
She has high blood pressure.
Okay, and she's taking medications for that?
Um, I think I don't live with her, but I think she's on medications.
Okay, okay. And do you know that she have any allergy or something like that?
I'm not aware of that.
Okay. Could you tell me, like, are you her next of kin?
Yes,
Okay, and the lasting power of attorney?
I do have the lasting power of attorney. Yes.
Okay, okay. And you've told me that you're not living with her, so who was taking care of her, or there does she live alone or with anybody?
No, she lives alone, and she's doing everything for herself. She's totally independent. I just live nearby and just checking on her every now and then.
Okay, okay. That's that's really great. You're such a caring son. So, I'd like to update you now about her condition, but do you have any concerns before that to be addressed?
I want to know what is her condition now. No one is telling me my mom's condition. She is in the hospital for 2 weeks, and the doctors and nurses are very rude. When I ask them what's my mom condition, they tell me, well, we are busy.
Oh, I'm really sorry that that should never had happened ever. Could you tell me, was there a certain nurse or a certain somebody told you that, or you do you know
I
who?
don't know the names. I don't know the names, but everyone here is just rude. They don't tell me anything.
Oh, I'm really sorry if you experienced something like that. Okay, I'm gonna help you now, and I'm gonna update you. Um, I'm gonna help you. So, your mother's condition, first of all, she had a heart attack in the past. Do you have you been aware of that?
Heart attack? No, I don't know. Maybe.
Okay. So, she had in the past she had a heart attack, and she was admitted here in the hospital because she had some heart failure. Have you heard about something like that before? Will I Can I explain it, or you?
No, they didn't tell me anything. What is heart failure?
Okay, so heart failure exactly is when the heart is not able to properly pump enough blood. So your mother was admitted here with that, and she had we did all the assessments and she received medications, and she's improving. Uh, but I have some a little bit some not a good news. She's would you like me to
Two
proceed with
minutes
that?
remaining.
Okay, well, what's the bad news?
Okay, so do you have anyone around you so I could tell you? Do you need any support around you?
What's going on, doctor?
Okay, so she's not feeding right now. Uh, she's not able to eat and drink well. So she was gonna be admitted for a while with us, and we're gonna check on her and provide her with tubes so she could be able
This
to
is
the
this is
food.
my question. This is my question. Why she's not eating?
Okay, okay, I'm gonna answer that in a while. Now, sorry, I'm sorry. So since she's having a heart failure, as I told you, and her heart is not able to properly pump blood. So she has some difficulties in feeding, and that's why we're gonna give her and provide her with fluids so she could be able to take to be supported as I told you.
No one never told me anything about this. You are telling me that my mom's heart is failing and I don't know for 2 weeks? What if
No,
she's your mom?
I'm really sorry you're feeling that way, and I'm totally here. And this is not acceptable that way that happened. And I'd like to tell you, if you like to want to we'll just investigate in that more, and we'll see what's the cause of that happened. So we're gonna fill an incident form regarding that. How does that sound to you?
I
Move
want
on
to
to the
talk to the
next station.
consultant. Time is up. All right. Thank you, so, Dr. Sofsana. Thank you so much.
Okay.
Okay, just bear with us. Dr. Whom, the next one?
Yes,
Uh,
doctor.
Dr. Hiba, right?
Yes, doctor.
Okay. Yeah.
Yes.
Do you want to read the question or do you want to have?
No, I can start.
Okay. Uh,
Begin.
Start.
Hello, am I speaking to Mr. Adam?
Yes.
Are you the son of Mrs. Maria?
Yes.
Could you please confirm her age for me?
She's 80.
Okay, hello, Mr. Adam. I am Dr. Hiba Basyuni, a junior doctor in the medical ward. And I am here to speak with you about the case of your mother and to address all your concerns. Okay?
Okay, that's good. Someone here is for me.
Okay.
I'm not happy with what happened, doctor.
I can see that you are quite upset. Can you tell me, please, why?
Doctor, no one told me about my mom's condition for 2 weeks now. I
Mm.
just need to know what is her condition now, please.
Oh, I can see how you are concerned about your mom condition and how you are upset regarding not one telling you anything about your mom condition. And I am sorry you feel like that. I am here to tell you what you want to hear and to address all your concern. But
Okay.
please, can I ask you a few questions to get better understanding?
All right. What do you
Okay.
want now?
How much do you know about your mom condition?
I don't know anything, as I told you, doctor. All what
Okay.
I know that she has shortness of breath, and the neighbor took her to the hospital, and
Yeah.
that's it.
Okay. And when was the last time you see your mom?
I see her every day for
You
2
saw
weeks.
her today?
Y- Sorry?
You saw her today?
Yes,
And how is she doing today?
she's not eating.
Mm-hmm. Okay. Okay. And any other concern?
I just need to know how is her condition now, please.
Okay. Okay. Can I ask you, are you her next of kin?
Yes, I'm her next of kin.
Do you live with her?
No, no.
Okay. And does she has any medical condition, long-term medical condition?
She has, I think, high blood pressure.
Yeah. Okay.
Yeah.
And she lives alone?
Yeah, she lives alone. She's totally independent.
Mhm.
I live nearby and just checking on her every day.
Okay, okay, that is fine. I understand that your mom was admitted to the hospital because she developed a heart failure. Do you know what is the meaning of heart failure?
No.
This means that her heart is not able to pump enough blood to her body, and this what causes her symptoms like shortness of breath and chest pain and other symptoms. And she is receiving her treatment now, and thankfully she is improving as well. Are you following me?
Okay.
And I
Why,
understand.
why, why,
Hmm.
why your colleagues were very rude and they didn't tell me what you said?
Oh, I'm very sorry that you have experienced it or you feel like that. But can I ask you who specifically do you speak with?
I don't know. I just
Hmm.
asked some of the nurses and your colleagues, the doctors there, and when I told them what's my mom's condition, they tell me always we are busy.
Mm-mm. Okay, I understand. Of course, I understand you're upset, and families shouldn't feel like this. Families shouldn't feel support and getting better information and clarification uh, about their patient's condition. But did you ask for formally for a meeting with the team caring for your mom?
No, I didn't ask. I
Mm-hmm.
just asked them like this while
Yeah.
they are here.
Actually, this is the point. As you know, the doctors are not really are in the ward. They may be doing in the clinic. They may be asking for scans. They are always busy. But of course, this is not an excuse. I just mention it to you to get better understanding about the nature of the work. They may not be present at the moment. Okay,
Mm.
so if you would like to have a good clarification, you should do a formal asking about a meeting with the team, and they will be more happy to explain everything about your mom condition. Are you following me?
Okay, so all right. Thanks for clarification. So, can I talk with the consultant then?
Of course, I will arrange a meeting with him to talk, but unfortunately, he is not here now. So, if you want to ask about anything, I am here to answer all your concern.
Okay, so why she's not eating then?
Actually, she is not eating, has many causes. One of them may be due to, the stress of being at the hospital. Maybe the food is not in her favor food, but we are trying with her. We are trying with some soft food, and if she continue refusing food, we may involve a dietitian. Okay, but make sure that we are keeping her dehydrated and keeping observing all her vitals, and she is stable. And we will update you regularly with every step in her management. Okay.
2 minutes remaining.
Okay, all right. I've just,
So, hmm,
thanks for clarification, doctor. I just, she's my mom. What if she's your mom?
of course,
Do you
I
understand what
appreciate your
what I
caring.
mean?
I appreciate your caring. Of course, she is your mom, but I want to make sure you to be assured that we take care of all our patients equally regarding their needs, and we are very keen to explain everything regarding what is the patient and the management plan, and we are here to help the patient and the families as well, because we know that you are going through a difficult times. Okay, so please feel free to ask anything, and I am here to answer all your questions. Do you have anything else you want to ask about?
I just want to lodge a complaint against the doctors, not you, the other doctors and the nurses in general.
Okay, that is completely right. I will guide you to the complaint team. We have here a team in the hospital. You can formally raise your concern, and they will help you to take your steps as you need. Anything else?
No, thank you.
Okay, thank you, and I hope rapid recovery for your mom.
Thank you.
Thank you.
Okay, thank you, Dr. Heba. Thanks, Dr. Heba and Dr. Sausana. So, Dr. Sausana, how do you feel?
I didn't manage it well, to be honest. I just it took a lot of time to manage with the patient.
Okay, and how do you feel about the management part of Dr. Heba?
No, it was perfect, to be honest.
Okay, so I'm not saying that you this was the first thing that I highlighted at the start of the session. We are not comparing to criticize everyone. We are comparing just to understand more about what could be done better to do the patient.
Yes, we are learning from each other. That's the point, yeah.
This is the thing. All right.
Yeah.
So, okay. Well, Dr. Sausana, I will comment from the start till the end and will compare between both of you. Okay? Yeah? So, in data gathering, in this case, do you think Dr. Sausana asking about any chest pain, any allergies, next of kin, lasting power of attorney, all of these are relevant to this case?
No, I don't think so, no.
Okay, and are you convinced by this?
Yes, I think that took me too much time to get to the management part.
Yeah. Okay. So, the patient is already admitted for heart failure. The patient, the relative told you shortness of breath. You don't need at all to ask about the symptoms that she had before the admission and any allergies, any medical conditions, any blah, 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 blah. Everything is explained to you in the question. She has heart failure. She was admitted and she's now improving, and that's it. Okay? So what really matters is asking, why is the patient upset? This is the first question in the data gathering. Why the patient is upset? You did that. Okay? Then does he see his mom every day? Does he checking on her? How does he feel about the admission? Does she live with him? Is she dependent or not? Okay, these questions that will help you, building rapport with the patient and answering his question appropriately. Okay. So, Dr. Sausana, we're asking irrelevant questions. Yeah? Dr. Heba, but you succeeded to absorb my anger. Dr. Sausana, okay? You told me I can see how you are upset or how you are unhappy. I'm here to help. I will do my best to help you, which was really nice. Okay? But the data gathering part was not relevant. Dr. Heba, Data gathering was relevant, to be honest. Okay. But I felt the tone of voice at the start of the station was different from the end of the station. You're very, very, very calm at the start of the station to the point that I felt that you're not caring.
Mm-hmm.
Got me, Dr. Hiba?
Yeah, because I'm very nervous. I'm trying to calm myself.
Right. Okay. So, but you managed to play with your tone of voice in the management part.
Okay.
Okay. So this is in terms of the data gathering. Next of kin and lasting power of attorney is not important at all here, doctors, please. The patient has a consent to talk with him, okay? Nothing to, no decisions to be taken in this case to ask for lasting power of attorney. You don't need to ask if he is next of kin or not, because you have a consent to talk with him. Okay? If it's not mentioned in the question, that the patient doesn't have a consent, then you can ask, are you the next of kin of Mrs. blah, 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 blah? And then you tell him, well, okay, I know that you want to know about your mom's condition, okay? But to be honest, I just need to check on her first and ask her, and if she's happy for me to discuss everything with you, I'm more than happy to discuss that with you. Why? Because you don't have a consent, and the patient is mentally capacitated. They didn't tell you that the patient is dementia patient or confused. Okay? Got me, doctors? Got this
Yes.
point? Is it clear?
Yes, clear.
All right. So here the consent has been taken and no worries about confidentiality at all. Okay. In terms of the management, Dr. Sausana, you were trying to calm me down, okay, which was good, but you said some phrases that can sound that you are blaming people around you, okay? You told him, oh, I'm really sorry for that. This should never happen, okay? So you tell, I'm so sorry for this experience, okay? And please accept my apology. And I'm here to help and understand more about what could be happening. And I will talk with them about what happened exactly and explain to you. Or, as Dr. Heba said, did you take a formal meeting, or did you arrange for a formal meeting? Clarifying. This is what we were talking about at the start of this session. Okay? Clarifying. Okay? This patient maybe doesn't know that meeting should be arranged to talk about the patient's condition. All right? He just asks everyone in the ward or in the hospital. The doctors are not supposed to answer everyone about every single condition. Maybe the patient is not under their care. Okay? So clarify. Okay? And Dr. Heba clarified. She didn't justify. She clarified. Okay? So Dr. Heba clarified to me that this should be arranged by a meeting with the caring doctor or the doctor who is taking care of the patient. They will explain everything to the patient. She explained as well why the patient is not feeding. And she explained to me that my mom was admitted because of something called heart failure, and she explained to me. I would give you an advice here, Dr. Heba and Dr. Sausana, in terms of how to explain the situation. You can tell him, well, as you mentioned to me, she were having shortness of breath, okay? And she has some medical conditions as well in her heart, okay? And we have assessed her and we have done some investigations, and the shortness of breath caused by something called heart failure. Have you ever heard about that? And then explain to him if he doesn't know. Okay? But if you don't have a consent, then you will tell him, I'll check with, she is well looked after. Your mom, is she well looked after? And I will check on her. And if she is happy for me to explain her situation with you, I'm more than happy to explain everything to you. All right, doctors? So be aware of the information that you have in the question. Okay? Dr. Hiba was having clear explanation to everything and, clear management steps. Dr. Sausana was not very clear, and she was just trying to, absorb my anger by acknowledgement and acknowledgement. Okay? So please, Dr. Sausana, always be minded that in every angry case, you will find that the patient has misunderstanding about something to clarify. Okay? So please clarify to the patient here what should be happening in terms of meeting. If you want to talk with the consultant, yes, it's fine, but we will arrange for that. And why she's not eating, Dr. Sausana told me because of the heart failure, which is a good answer. Yes, heart failure can cause poor intake, which is good. But Dr. Sausana dealt with the case as if it is breaking bad news.
Yes, I dealt with that like that she's not feeding, so she's having a complication. So I'm just telling you that she's not
Yeah.
feeding right now, and we are gonna support her regarding that. I thought that it's like a mixed station, so
Mhm.
that what made me like hesitated.
But
I don't know, is it breaking bad news or angry patient? So I thought it's like something mixed. So I tried my best to deal with both.
yeah, okay. So this is not, to be honest, she's not eating. Is it a bad news? Is it something that will change the patient's life? Did they say that the patient is not feeding and the condition is deteriorating? She is on palliative care now.
No, no, no.
Okay. So it's
Okay.
just she's not eating. Yeah.
Mhm.
So
Okay.
it's not a, bad news means that this news will affect the patient's life and the relative's life. Okay? And they didn't tell you anything about that. So it was inappropriate to deal with this case as if it is breaking bad news. Okay? Yeah. All right. So do you have a clear understanding about the case now, Dr. Safsana?
Yes, doctor, yes.
All right, good. This is my aim. This is my aim because people just read the notes and just try to do what they know about the case from here and there, and they don't really understand what is the reason behind the case, or what is the main issue of the case. Here you have to absorb the anger by acknowledgement that he is upset. Why he upset? After that, check some questions, like, is he checking on his mom every day? How is she now? How does he found her? If he has any concern about her, how does he feel about the admission? Does he need any help at all, psychological help or anything? Yeah, and then you clarify to the patient um, why maybe this happened. Okay, and you tell him, I'm really sorry for this experience. Okay, I'm really sorry, but let me clarify to you that usually we arrange meetings between the family and the doctor who is caring about the patient or caring for taking care of the patient, and they explain everything in the meeting. Okay? All right. Any question about this case, doctors? So we have covered 2 cases of angry with 4 different doctors. We compared between the performances. Yeah. Hopefully until now you got much more insights about how to deal with angry cases.